welcome back to my channel. I'm so glad that you've come here today. Today we're going to talk about all of those unspoken topics regarding postpartum recovery. So when I put it out to you guys, a lot of you said that there were things that you didn't realize happened until you were actually in your very own postpartum experience. So today we're going to be breaking all of those taboos and talking about everything from that first poo to how bleeding postpartum might look for you. Make sure and stay tuned and let me know down below in the comment section what was the biggest surprise for you postpartum, what was the thing that you struggled with most. So if this is your first time joining me here on my channel, my name is Kitty Hackle. I am a lactation consultant, registered general nurse, a birth and postpartum doula, antenatal educator, and hypnobirthing instructor. I'm also mum to 2 little boys and bonus mama to Jess, who is my stepdaughter. So on this channel, we talk about everything from birth to pregnancy, to trying to conceive, to postpartum, to breastfeeding, and everything in between. If you're interested in that kind of content, make sure and hit that subscribe button, hit like on this video if you want to see more of this kind of video, and make sure and hit the notification bell if you don't want to miss my next one. So let's get right into it. The first thing when I asked what was the thing you didn't know about postpartum until you actually experienced it, was the fact that many of us, in fact the majority of us, still look about 6 months pregnant after we have given birth. And the reality is that swollen post-pregnancy belly is there for a reason. We have created that space and that expansion for our babies to have that lovely womb home for the last 9 or so months. So it does take a little bit of time for our uterus to go back to its pre-pregnancy size. In general, we say it's about 4 to 6 weeks for it to really shrink back down. There are things that you can do to help that. Breastfeeding and spending time close and skin to skin with your baby releases oxytocin in our bodies. Yes, you would be right to consider it a familiar sounding hormone, because it is. It's the same hormone that releases in us the reaction to have those surges, those contractions that bring our baby from inside our womb to earthside. So they're the same surges that bring our baby to us, that help our uterus shrink back down to size. You might notice that they happen when you're feeding or nursing your baby, and being prepared for that is key. So having things like a hot water bottle or heat pack, having your pain relief taken regularly, so you can take paracetamol, ibuprofen or diphenhydramine. They're all safe if you're breastfeeding. And using your birthing breath as well can be really, really beneficial. But just being aware of that so you don't get a fright by it can be really, really helpful. So yes, it is totally normal to look a little bit pregnant for a little while after having your baby. The next thing is those day 3 blues. Oh my goodness, did I cry. I learned a new phrase this time, and that is called the hormone soup. So I'm using it, I'm running with it. I think it's the perfect description for just how immersed in that mess of hormones, that surge of hormones that happens around day 3. And generally it coincides with our milk coming in and transitioning from that delicious, sticky, golden colostrum to the more mature milk. So with that comes the outpour of emotion. So as the milk is flowing, the tears are flowing. I feel like at that point you are so very vulnerable. So being prepared for that and knowing that you're not crazy, that this is absolutely normal, this is just a part of the process, can really help you get through it. Letting your birth or postpartum team know that you might feel this way around day 3 can be really beneficial too, and figuring out how you can mind yourself during that time, whether that is just staying in the bed and getting cozied up and just getting through it together, plenty of time skin to skin, maybe a nice warm shower, things that you can do to help you feel supported and minded during that time. So going along with the last point of that postpartum day 3 blues, where we have that downpour of the tears and all of those emotions which coincide with our milk transitioning in, and that all of the hormones that come into play there, we also might have that sensation of engorgement, where our breasts, whether or not you're nursing, can become really full and heavy, and it can be really quite uncomfortable, and as well as uncomfortable, quite difficult for your baby to latch. So learning about what you can do to sort of mind yourself and your breasts during that phase of engorgement, because it can be quite uncomfortable. You're thinking a warm compress before a feed to get the milk moving, a cool compress afterwards. Some people will encourage you to use cabbage leaves. I would suggest you err on the side of caution with that. And if you are going to use them very minimally, because they can have an impact on reducing your milk supply, which is not what you want when you're simply just trying to get breastfeeding established. If you find that your breasts are very full and that your baby is finding it very hard to latch on, check out the reverse pressure softening technique so that you can help your breasts soften before so your baby can get a nice deep mouthful of the breast tissue to help you and your baby be more comfortable when it comes to your nursing sessions. The next thing that a lot of these mamas didn't realize is that you bleed postpartum, and a lot of us think, oh, it's just that first period, but it also is where our placenta is adhered or attached to the inside of our uterine lining. That comes away after birth, leaving behind it about a dinner-sized plate wound inside our uterus. So not only does that need to heal, where our uterus has to sort of clamp shut on top of it to stop it from bleeding, but we also have any kind of bleeding related to any tears that we might have already experienced, or just that lining of that uterus that has been that nice spongy cozy lining where our baby has been all snuggled up this time, also has to shed. So yes, like your first period. So with all of that being said and done, a lot of us will bleed for the first 4 to 6 weeks after birth. For some, that might be shorter, depending on whether or not you've had maybe more interventions during your birth, whether you've had a cesarean birth or a vaginal delivery, and how much rest you've been having. So for me this time round, I noticed that my bleeding sort of stopped around week 4, whereas last time when I wasn't resting as much, I wasn't minding myself as much, my bleeding went on as far as week 6 and week 7. Although it was very light towards the end, it was still there. So really minding yourself means that you are going to have a much more pleasant experience in terms of your body's ability to heal and recover from birth. So some of the things that might be worthwhile noting when it comes to your postpartum bleeding would be any change in smell or colour or consistency. So if for you, your bleeding has been sort of a reddish, brownish colour, which can be very normal, but it's all of a sudden gone kind of a greeny tinge, that could be an indication of infection. Similarly, so if the odour has changed and become anything that's unpleasant. Equally, we're looking out for the amount. So if you are bleeding through a pad in an hour or less, you're talking about going directly to your care provider. And if you're passing a clot that's any bigger than the size of a small egg, all of those would want to be highlighted with your care provider. Of course, I am not your care provider, so make sure and touch base with them if that is something that you're concerned about. The next one is probably the one that you've all been waiting for, and that is my tips around the first poo after birth. So whether you have had a vaginal delivery or a cesarean birth or anything in between, that first poo can be quite a worrying experience, and I'm here to make it as easy for you as possible. The first thing that I would say is you want to be making sure that you are taking something that is going to help your stools be nice and soft. So the softer they are, the easier they will be to pass. So for me personally, I always say that you want to have a carton of prune juice ready in your fridge, and it be one of the first things that you take after birth. So 1 glass with half warm water and half prune juice every day for at least the first 4 weeks after birth can be really, really beneficial. So that's for the softening ability. Alternatively, you can also just take over-the-counter stool softeners that your care provider might have already prescribed to you. Other things that you can do is to go with your body's natural urge so that you're avoiding straining and avoiding putting any excessive pressure on your pelvic floor muscles, which of course you want to repair and heal and not do the opposite and create more damage to. So that might mean going with our natural instinctual urge, which that reflex generally kicks in about a half an hour after our first meal. So you're thinking about perhaps when you have your breakfast, creating a little window of opportunity where you have somebody who can hold or mind your baby, where you can go up to the loo and have time to just allow things to happen. You want to be avoiding straining on the toilet. So that means waiting for that natural urge, yes, but also adopting the most appropriate position, which is a deep squat. So I found a squatty potty really helpful for this. We actually always have one by our loo, and I think it's a really good thing to have. You can get a little step from your local Lidl or Aldi whenever they have them in, or IKEA do some fantastic ones. I'll link one here down below that's also really fantastic and actually looks kind of cute, which is a bonus. We use it for our toddler step as well. So having those means you're adopting the correct position where it's much easier for everything to evacuate your body, and it's much more comfortable for you without the need for any excessive pressure or straining. And the last thing you want would be to have any excessive trauma down below, or to be creating any sort of pressure where you might already have hemorrhoids or discomfort already. You might also find, in order to make it a more comfortable experience for you, to be using your same birth breath that we would teach in hypnobirthing. So that sort of opening, relaxation of the pelvic floor, and that using that nice breath can help everything relax. Whereas the temptation when we're scared or fearful of something is to clench tight and hold everything in, which of course your body is going to react to that and just go, nope, nothing is happening down below here. So you want everything to be softening, opening and releasing. Very similar to birth, you'll realize. The last thing then that I will recommend you do is to drink plenty of water and eat high fiber foods. So that's something that might sound really obvious to you, but on an ongoing basis, eating high fiber foods simply isn't enough. It needs something to cling to. So that is making sure that you have a nice high water content and nice high fiber content in your daily meals. And lastly, when it comes to support measures for that first experience where you're doing a poo after birth, is a little bit of reverse pressure. So that might mean a little compress, whether that's using a pad or a bit of tissue paper rolled up around your hand to place a little bit of pressure against your perineum where you might have a little bit of stitching or maybe an episiotomy or a little bit of tearing. So placing pressure on that can be really comforting when you're feeling sort of that pushing sensation against that area. So doing that can make it a little bit more of a relief for you. So in talking about that first poo, we also have to talk about your first wee after birth. And that's also a strange one. Since so much has gone on down below, it feels a little bit odd to just do a wee as normal. Not only that, but if you've had any degree of tearing at all, even the tiniest little bit of a graze, it can be quite a stingy experience. So here are my top tips. The first one is get into the shower. If you can do your first wee in the shower, not only do you have that nice warm water trickling over you to help encourage you to go, but also that warm water will dilute the acidity of your urine to create a much more comfortable experience. The next tip would be the alternative. So if you're not able to hop into the shower, if you're in the hospital experience, to bring a little squirty bottle or a peri bottle with you to fill it up with warm water and to spray that over your vulva as you go to the toilet to help dilute the urine in the same way that you would in the shower. The only caveat to that would be letting your care provider know that this is what you plan on doing, because they like to often know what the volume of urine that you have passed is to make sure that you have been able to have a complete emptying of your bladder after birth, that there's no sort of urinary retention going on there. If you're finding it a little bit difficult to do that first wee, there are some tips that I also recommend. The first is simply to run a tap alongside when you go to the toilet. Sometimes that little auditory stimulation can help us to release. Another thing that can be really helpful, and I've used a lot of times with my home birth clients, is to put a few drops of peppermint oil into the toilet bowl before you go. Something about peppermint oil helps us to release whatever it is that in our bladder and be able to do a full and complete bladder. The next taboo subject is, oh my gosh, the baby wants to be on me all the time. And that's something that didn't quite take me by surprise, but certainly I wasn't ready for the degree of how much I would be needed. I think it's because we're just constantly exposed to these sweet pictures of babies swaddled up in their little nest or buggy or lying open on the bed. We're not often seeing these pictures of babies just on their mum's chests or on their mum's tummies. So for us, oftentimes it becomes sort of a bit of a fright when all of a sudden there is no alternative, when the baby just wants to be close to you. But I'm here to tell you that it's completely normal. In fact, you've got a really clever baby, because your baby, who has been close to you and hearing you for the last 9 months and smelling your scent, wants to be close to you to connect with that. So them wanting to be close to you is not something about them being needy. They are not creating a rod for your back by you holding them close. You are never going to regret cuddling your baby too much. Some of the things that you can do if you do want to make it a little bit easier on your back, or if you're finding that that load is just a little bit too much at times, is to try baby wearing. This is honestly the best way to be able to have your hands free, as you can see, to be able to do things around the house, but also if you have another child that you need to attend to. Babies get to stay close, they get those cuddles, they get those close contact naps, a lovely way of getting a little bit of skin to skin time as well, which of course regulates their blood sugar levels, diversifies their microbiome, regulates their temperature and their heart rate and their blood sugar level, all while mum is able to be hands free. But another way, if you do want to put your baby down for a minute, is rather than lay them, oh, I've got a baby here, look. Rather than lay them flat onto their back and stimulate their Moro reflex, which is the reflex where they go, oh, and they startle like that, is if you, in fact, put your baby in sideways into the cot or onto their little bed. That way you're not stimulating the Moro reflex, and you have a greater likelihood of your baby being able to stay asleep in that position. I'll make sure and link the safe sleep guidelines down below as well, just in case you haven't seen them yet. So those are my top 5 things that nobody tells you about when it comes to that postpartum experience. I hope you found these helpful, and I'll see you in my next one.